Hi, I'm Dr. Mary Pardee. I'm a naturopathic medical doctor, and today on Ever Forward, we talk all things gut health. We talk about the microbiome, we talk about mindful eating, why it's so important to slow down. We even dive into my own personal trauma and how that affects your general health, and so much more.
3, 2, 1.
All right, doctor's in the house. Dr. Mary Pardee, welcome to the show.
Thank you, Chase.
And you just came from the office.
Just came
from the office to do what you do every day, and now we're here to talk about what you do every day. So are you tired of talking about
No.
health and human performance at this point yet?
This is what I love. This is why I do what
Okay.
I do. So I'm in my element for sure.
In your element, and your element is a very kind of specialty element. So ever since I've gotten to know you and seeing everything that you talk about in social media and in your practice, you've really gone down the intestinal tract,
Yeah.
gut health. What was it about the gut that was just so appealing for you, and what have you found to be just the most exciting part about this system of the human body?
Yeah, and I think a lot of people come into more alternative or, natural medicine because of their own healing journey.
Yeah.
And so that was it for me, for sure. So I had gut issues growing up as a young kid, diagnosed with IBS, irritable bowel syndrome, chronic constipation, bloating, just like not feeling well.
All the fun
migraines.
things.
Yeah, nothing that you actually want to talk about on a podcast, but by this time I'm very comfortable talking about it.
Sure.
And so it was my own journey. I went to see a bunch of gastroenterologists. I did the whole conventional medical route. My mom was a nurse, so we started through conventional medicine. And eventually I stumbled across a naturopathic doctor and was obsessed with how much she knew about the body that doctors had never told me before. Talking about circadian rhythm, talking about bile acid and stomach acid production, all these intricacies. And so I started on that journey of figuring out, okay, how am I going to heal my gut? And this then made me go back to naturopathic school, do a full medical degree, and heal my gut through naturopathic medicine.
So learning wasn't enough for you. You actually had to become the thing. That's amazing. I love
Yeah.
it. Not only just like kind of treating and healing yourself, but you cared that much and it had that much of a profound impact on you to study it and then to help others, I'm assuming, right?
Yeah, and I think during my journey, I had met a bunch of doctors along the route. I had had a colonoscopy when I was really young, endoscopy, like all these things that young girls usually don't have to go through.
Yeah.
And I remember I met one doctor, and this was, I was in my 20s at this point, still didn't feel well. And he looked at my chart for like 2 minutes and looked at me, and he's like, "You've been everywhere. You've done everything. There's nothing else. Basically, you're out of options. You're just going to have to live with it. It's not that bad."
Wait, a doctor said this to you?
Yeah.
At what age?
I was like 23, 24 at this point.
How did that fall on you? You were just like, I have to accept it at 23. This is just my life.
I left the appointment in tears.
Yeah.
And I'm not that much of a crier, although it's fine to be a crier.
I cry all the time. It's
Yeah.
all right. Even on the show sometimes. We'll see what happens.
Yeah. And so I was really disappointed. I was really disappointed with his bedside manner as well. It did not feel like, a relationship. And a lot of what we do as doctors is actually that rapport building. And you can tell how much better a patient is going to get based on the rapport you have with the patient as the patient-doctor relationship. So that's an aside, but so I was disappointed with how the appointment went, how little time I got with him, and just his bedside manner. And so I left that being like, I never want somebody to leave my visits feeling like this, and I never want somebody to feel hopeless. And that's really what I felt, was like total hopelessness. And so that's kind of like what really spurred this idea of wanting to become the doctor that I didn't have. And there's tons of great doctors like that too. And so I think it's really putting the patient in the center of treatment and saying, how can we support this person where they're at? And so that's really what kind of pushed me into wanting to actually become it and not just learn about it.
I'm sure no one listening can relate. I mean, everybody's just had the best medical experience ever, all the time. Definitely not anybody who goes to the VA for medical care. I hope you can sense my sarcasm, listener, but it's one of those things that I imagine when you find a doctor that hears you, that listens to you and hears you, how much more likely they are to heal, to get well, to stay well. Is that a big part of what you strive for? Is that rapport and is that connection outside of just the medicine with your patients?
It's huge. That's a big part of it. And that's why I have like 10, 15, usually 15 minutes that I could go over with a patient if I need to.
Built into that
Built
patient
in,
time.
yeah.
Amazing.
Even more. Sometimes we block off an hour for a 30-minute appointment. So I really want to be able to sit with the person as much as I can and really listen to them. And I'm also starting to work with an integrative psychiatry group because I think
Oh, no way.
this is where the magic happens, is when we're actually listening, we're creating community, and we're talking to the person not just about their gut health, but also about their relationships, their relationship with food, their community, you know, their environment that they live in, how much sunlight exposure. All of these things come into play.
Where have you seen what you were just talking about suffer the most over the last year? And, you know, we'll kind of maybe narrow it down to community, because most of us have been really, really restricted or really limited to maybe the community we're used to. How in the last year, here we are, March 2021, have you seen that come up with your patients in terms of maybe they're getting sick or sicker or not recovering as well?
Yeah, and I think people have dealt with it differently, which is always going to be
Very
the
true,
case.
yeah.
And so, you know, there's a large group of people who have had a lack of community, a lack of social interaction, a lack of feeling like they belong because of isolation. And so, you know, that subset, I've really seen people have struggles with that. And it doesn't have to be gut health, but really increasing rates of mental health issues we're seeing. And so it's a definite concern where we're taking away community, we're kind of sacrificing something here. And I know that this is controversial, but I'm a big believer in that we have to look at the full picture of the pandemic, and we're coming out the other side. So, you know, I think that things are getting better.
Thank God. I'm sure everybody listening is hooting. Hooting and hollering. But that's my Virginia's coming out a little bit. But yeah, we are. Very true.
Yeah, but I think what we did during the pandemic was a little bit of a trade-off. You know, we prioritized reducing numbers from getting the virus, which was extremely important. And in doing so, though, the trade-off was mental health. And so, you know, that was just a repercussion. We have to think about that, and we're going to have other pandemics likely in the future. So we have to look at the numbers there, you know, increased rates of suicide, depression, anxiety, all of these things. Was there a way we could have done it better, or is there an alternative, or are there measurements that we can put in the future where we have, you know, more support in those areas? I work with, you know, people in the addiction community as well, and they're saying rates of relapse have increased.
Really? Wow.
Just because people don't have the same support networks, even like AA meetings, like all of these things, where are these people going?
They fall back on previous coping mechanisms that probably don't serve them, right?
Exactly, yeah.
So with all of that, mental health and what you specialize in, gut health, is there a link between the two?
Yes.
Short answer, yes.
That's the answer. I'm like, yeah.
What is it? Like, what is it about when maybe our mental health is great, when we're happy, we're healthy, we're fulfilled, and when it's at the other end of the spectrum, and how does it correlate to poor gut health and good gut health?
Yeah, this is called the gut-brain axis, and so a lot of people have heard it. The research keeps coming out about the gut-brain axis. We also have the gut-kidney axis. We have, you know, the microbiome, which is the gut bacteria, liver axis.
So have basically how the gut just connects to
everything.
Other organs.
Yeah,
other
all of our
systems,
organ systems communicate with each other. The gut-brain axis is really special because we have a physical connection from the gut to the brain. The vagus nerve is something that connects these two systems together. And then we also have biochemical connections to these two. So we have a gut microbiome. It houses tons of genes, microbes, bacteria, viruses, fungi in our intestinal tract. And these things produce things called postbiotics, short-chain fatty acids, chemicals, like all these things that can actually then interact with our human cells. So say we have bacteria in the intestinal tract, they eat fiber that we consume in the diet. by them consuming the fiber, they then produce things like butyrate, which is a short chain fatty acid. They also produce, other chemical messengers like LPS, which is a negative thing if we have certain bacteria. Positive and negative byproducts. These things then cross over the intestinal tract into the bloodstream. They can circulate and they can go up to the brain.
So what's going on in our gut? I just want to paint the picture for the
Yeah.
listener here. So what's going on in our gut has the potential to permeate into our bloodstream, which then goes basically everywhere, right? Yeah.
Yeah, and one of the places can be the brain.
Yeah.
So, for instance, there's endotoxins. Say you have too much of a gram-negative bacteria, then you can actually produce things called LPS, lipopolysaccharides. These can then cross the blood-brain barrier and increase inflammation in the brain, neuroinflammation, increasing, the likelihood of brain fog, depression.
I was just going to say, what does that kind of really look like in real life? And
Yeah, brain fog is, feeling like you're not clear-headed, like your head's in the clouds, lower energy levels, kind of scattered, things that we can all relate to, right?
Yeah, for sure.
And so we have this connection, and that's a negative one, but you also can produce things like butyrate. Butyrate's a great short-chain fatty acid that's produced when you have enough fiber in the diet, and that can cross the blood-brain barrier, and that can actually reduce inflammation. It can increase BDNF, brain-derived neurotropic factor, that increases neuronal connections in the brain, creating new circuits and reducing the risk of dementia.
That stuff's wild. I occasionally will supplement with that, and it's just like taking the dimmer from like medium to all the way on.
Awesome, yeah. And we can produce it naturally through exercise too, BDNF. But so there's a neurochemical way to actually connect the brain and the gut as well. And so this gut-brain connection.
Is your deep south coming out too?
Yeah. This gut-brain connection is bi-directional, which means the gut affects the brain affects the gut.
So it goes interchangeably.
It goes interchangeably. And that's
okay.
really important because people will come to see me. They've heard me talk on podcasts and they're like, yep, I think that my gut health is causing my depression, or it's causing my anxiety, or, I think it's the reason why I have no energy. And I'm always saying it's a piece of the puzzle.
Okay.
It's never 100%.
Is it one of those things like chicken or the egg, which came first? Like your poor brain health is causing poor gut health and vice versa, maybe?
Yeah, and it's really hard to tell which one came first. But I'm always telling them that's why I'm working with an integrative psychiatry practice now, is you have to treat both of them.
Okay.
So, I think it's really important that we don't put all the emphasis on the gut microbiome for mental health. We have to also treat mental health by itself and look at our environment, our relationships, and all the things we know that are important.
I totally agree. So where would you say right now someone listening could maybe latch onto a couple concepts of, I'll make the blanket kind of assumption that people know about mental health, and at this point, 2021, it's an integrated part of like what you're talking about, your total health and wellness. Whether you're taking it into your own hands or you're working with a medical professional to do that, how can someone right now think about just maybe do a mental health scan? What are maybe 2-3 key areas that they should be able to say, yes, this is good, or no, I got some room for improvement?
Mental health scan. That's a good idea.
Yeah.
I like that.
I'm going to register trademark that right now.
Yeah.
All right.
First, one of the questions I ask everybody at their initial visit is, how much joy do you experience on a daily basis?
That's
0
something
to
I don't
10.
hear a lot.
Yeah. How much joy? Because you could say, I'm not depressed, I'm not anxious. How much joy do you experience? And it's really surprising some of the time where you'll see somebody that they're not complaining of anxiety or depression, but they say 2 out of 10.
Yeah.
That's something that you want to dive into, and you really want to get to the root of that. Like, where is that coming from? And so the next piece of that is your relationships. How are your relationships? Do you feel like you have friends in your life or significant others, somebody that you could read a book next to on the couch without speaking and feel connected to?
Going back to your point earlier of the community.
Yeah. Yeah, and I think we can have a lot of people in our lives, but do you have true, authentic connections? Do you have somebody that really sees you for who you are? And those are different things. And you want to dive deep into those because you see where, us as humans, we crave belonging. We crave a sense of belonging. We want to be seen for who we really are inside. So relationships is a huge one as well for mental health. And then, your exercise, how much sunlight are you getting on a daily basis? These are all things that you want to consider when you're doing, your mental health scan.
The mental health scan. Yeah, absolutely. So then shifting gears a little bit, what about the gut health scan? What are some key indicators someone can really just pause and can do a little biofeedback? How am I feeling? What shouldn't I be feeling maybe?
Yeah. Do you have constipation, diarrhea, bloating? Are you having a bowel movement every single day? Really
Huge,
common for women to have like 2 or 3 bowel movements per week. And a lot of them are going to feel like bloated, like they didn't fully void. And and then we want to talk
incomplete
about
bowel movements.
incomplete, like feeling like, I feel like I still would want to go to the bathroom, or, it feels like, something hasn't fully passed. And then you want to look at the stool too. And so, diarrhea and constipation are so subjective, but what does that actually mean? There's something called the Bristol stool chart, and it goes through like everything that your poop should look like. So if you guys want to Google this at home, Bristol stool chart.
So there's like a chart we can look at and compare to after we eliminate, like, and really at home analyze, hey, what's coming out of me is, spot on, or I probably need to make some adjustments in my diet, or, what are we actually looking at here?
Absolutely. It goes from 1 to 7. And 4 is your ideal poop. So 4 is, it looks like a smooth log.
Okay.
Number 1 are like those little rabbit pellet poops, which are just like little hard little pellets.
Yeah.
When you have those, what it means is you're constipated. You're absorbing too much water because things are moving too slowly through the intestinal tract.
Okay.
So when things slow down, your body has more time to absorb the water, and this leaves you with really dehydrated little stools. And so that's a sign of constipation. You want to increase your water intake, increase fiber. Maybe sometimes fiber can actually make constipation worse, but you want to first increase water for sure, and then talk to your doctor about why you're having those stools, because you want to test for small intestinal bacterial overgrowth or delayed motility. Like you want to get to the root of that. Thyroid health is going to affect motility as well. And then on the reverse side, number 7 is water. So it's just like pure water stools, and that's never normal. So, it's fine to have it once a year, something on occasion, but if you're having watery stools on a regular basis, you're likely
diarrhea.
Yeah. Then something's going on. You want to be screening for parasites and bacterial overgrowth. You want to be screening for Crohn's disease, ulcerative colitis, inflammatory conditions. So that Bristol stool chart is like the holy grail of poop. You can go buy it.
It's the shit.
It's the shit. You're going to fluctuate. So you don't have to have type 4 perfect stools every single day. But you want to be like right around that, between, a 3, 4, maybe a 5 sometimes, kind of flipping back and forth. And your stool should be about the size from your wrist to your elbow.
Whoa. What?
Lengthwise.
Like in total?
In total, lengthwise, per day. Can be a little bit smaller too, especially if you're small. If you're a small female, it's going to be a little bit smaller. Yeah. If you're not eating a lot of food, which is a really a common cause of constipation in women and men who are under eaters. If you don't eat a lot, you're not going to poop a lot, so you have to correlate that. Or if you fast one day, you're going to poop less. And then the color of it too really matters. Stool should be brown because of bilirubin, which is the breakdown of red blood cells in the body. And so if you have white stools, something's going on there. Are you not producing enough of the bile from your gallbladder? So looking at gallbladder health, looking at pancreatic health. If you have yellow stools, which means you're not breaking down fats, also gallbladder too. Red stools are not normal, so you want to rule out bleeding. So always talk to your doctor about those. But beets can also cause red or purplish stools, so some of your foods can do that too.
Some red juice or something, or those bright red vegetables.
A red juice drink for sure. So looking at the color too, and then gas. Are you passing gas all day long? That's not normal. It's normal to pass gas about 10 times per day, give or take.
So we can work up to our quota of 10 a day. All right, cool. All right.
If you're at the 50 mark, then you want to look at that. Why are you producing all of this gas? So that's kind of like your gut health check scan to start with.
A lot of great things in there, from gut health, mental health, and things that hopefully we're all doing every day, that we can just get a quick little reflection of what's going on in our bodies to hopefully adjust course. What have been some of the other things you've seen in practice that maybe are the most surprising to people when they would never have thought, like, oh, I've got something going on in my gut? Some maybe way it manifests in their life, or a symptom or something maybe that someone could pay attention to that, oh, like, hey, there could be something here.
Yeah, if you see skin issues. So if you see skin issues like atopic dermatitis, like eczema, psoriasis.
Any kind of like inflammation on the skin.
Inflammation on the skin. I'm usually treating the gut as well, and diet, nutrition changes, and really making sure that you don't have something called intestinal permeability, which is leaky gut is the layman's term, and making sure that you have a really just intact GI tract where you don't have LPS molecules passing through and increasing inflammation throughout the body. Also autoimmunity, same kind of thing. We want to be looking at the GI tract with any sort of autoimmune condition. And so sometimes people will come into me and they have, rheumatoid arthritis, and we're going to treat the gut with that because we want to make sure that you have good gut function to then balance your immune system, which 70% resides around the gut. To really support that balance of the
that number
system.
Keeps going up. Sorry to interrupt you, but that I think a year or two ago, maybe it was just what I was checking into, the number of your, like, the percentage of your immune system that lives in your gut. I saw it was like 62, 67. Now I'm hearing like mid 70s. I even was I had an interview recently. Someone was saying even upwards of like 80. So it's probably just more awareness theory, but I mean there is a lot of power going on down in our gut in terms of how our well-being is affected.
Yeah, I mean, it's where you get all of your nutrients. So it's where your body or don't. Yeah, it's where your body feeds from. And so if you're not absorbing things well, you're not digesting things well, then it's going to affect the health of your entire body.
Where in our everyday life are we doing things that are really good for the gut, and where maybe are some like no-nos for maybe like acute gut issues, but also just, treating it right for the long haul? Yeah.
And so the answer is it always depends on the person. So, what's good for one person may not be good for somebody else. An example, I'm not a huge fan of like kombucha for people with gut issues most of the time. And I think some people will drink it thinking that it is the holy grail. My issue with kombucha is you don't usually know what kind of bacterial strains are in there because you're just growing it on a Scooby and putting some sugar in there.
So in a kombucha, is there anything in any kombuchas that you do like?
I like the fact that it's acting as a prebiotic, but I would rather have a very targeted prebiotic where I know what strains are in there and I'm suggesting it to the person based on what we're trying to accomplish. So I don't think everybody should be taking a probiotic. I don't think that's necessary.
Okay.
But instead, if you come to me and you have constipation, then there's a strain of bifidobacterium that I can give you that I know helps increase motility. If I give that same probiotic to somebody with diarrhea, then that wouldn't be helpful, right? It would actually be hurtful. And so that's kind of one trend where I'm not on the kombucha bandwagon. Causes a lot of bloating for people. I think it can be helpful for some people, but in general, like, not my favorite.
But it's probably, would you say it's not a bad thing to drink, right? But not when we're trying to directly, affect our gut health.
Exactly. Like if you're super healthy and you like drinking one once in a while, it's not going to harm you.
Okay, cool. Because I got a couple in the fridge. I didn't want to have to throw them away.
No, you're good.
So some other things that people can be looking at that may be directly or indirectly affecting gut health.
Yeah. Other things in terms of what are we doing positively? Well, it depends who you are, but eating fiber is, it's the most boring thing to talk about, but it's really significant for gut health.
I've heard it's upwards of about 50 grams now is the recommended daily allotment. I was always in like that 25 to 35 range.
Yeah, I just got a little bit of slack on this. So the carnivore community does not believe that we should be eating fiber. Yeah. However, there was a study done by, I believe it's Stanford University, that showed that the average hunter-gatherer ancestor, it's looking at the Hazda tribe, was eating about 100, 150 grams of fiber per day.
100 to 150.
Yeah, that's based on that study. Now, the average American consumes 15.
Yeah, we're super low.
Super
Most
low.
Of us, yeah.
And then the RDA, what the U.S. is recommending, is about 25, 30 grams. And so if you jump from 15 to 100, you're going to feel terrible.
You're going to have
You're
some
going to be
discomfort.
super bloated. You're going to have a lot of gas. And so I'm telling people slowly increase, but aim for, about 6 to 9 cups of vegetables. If you're a really small, petite woman, 6 cups of vegetables per day. Bigger guy, 9 cups of vegetables per day.
Okay.
Most of those coming from non-starchy vegetables because you don't want to be eating a ton of carbohydrates.
Sure.
squash and things like that. So that's something that we can do really to affect our gut health. And the reason why is that remember that fiber feeds the bacteria in there so we can produce those short chain fatty acids, things like butyrate, which reduce inflammation systemically, can help balance the immune system if you have autoimmunity or preventing autoimmunity. They have like a number of effects. Actually, a lot of our genes in the liver are coding for metabolism genes that the microbiome will interact with.
Amazing. Wow. Okay.
So, your gut microbiome talks to the liver and helps to regulate those metabolic genes, either turn them on or turn them off to support metabolism.
What is maybe something that, in your medical professional opinion, most people this day and age you think are doing, something they're doing that is probably not best for the long haul for your gut health and really, your immune health as well?
Mm-hmm. Ooh, there's a bunch of things.
What's something you see that you're just like, stop that?
Okay, well, the stop that piece is being keto every single day, 24 hours a day for your entire life. And so this is a good one because it's trendy right now, right?
Yeah,
to
it's been a minute.
Keto. And so I think that it can be useful if you want to go keto for, a period of time and then come out of it, just because you're really going to be having a hard time getting enough of the fiber and plants. You can do keto right. And so if you wanted to really focus in on it, you want to make sure you're getting a ton of non-starchy vegetables because you can't eat the starches because those will kick you out of ketosis. And so I think that if you're doing that, then you can perhaps do it okay. But if you're really taking the approach of more of like an Atkins approach where you're eating, burger, cheese, and more of just animal meats, and you're not putting the plants in, then I think that you're likely doing harm long term. And again, that's long term. So could you do it once in a while, come out? Yes, absolutely. And the other one that's really simple is walking. We're not walking a lot anymore.
I say it all the time. People vastly underestimate the power of walking for like inserting stillness in your life. For me, it's like I call it walking meditation for clarity, for fat loss, for de-stressing. Now you're even telling us for gut health.
Yeah. So walking stimulates the vagus nerve, and the vagus nerve is the nerve that connects the gut to the brain, and it innervates the entire GI tract from the mouth all the way down to the lower part of the colon.
By how long do we need to be walking in order to do this?
I mean, anything is going to be good, right?
Okay.
But if you can go on a walk, at least a couple times per day, and I think morning and night are great bookends to your day where you can help your body get exposed to the sunlight in the morning so that you regulate your cortisol and actually increase it for energy throughout the day. And then at night, you can actually see the sun set, get that red light in there, and help you go to bed at night. But I'm always telling people around 10,000 steps per day is your minimum. And so you really want to be going upwards.
Not the goal, but the minimum.
The minimum.
I like that,
you should be averaging 10,000 minimum per day. And, our ancestors were walking like 6 miles per day on average. Some days they would walk 20 miles. So we really want to get back to that. And it helps regulate the nervous system and reduce anxiety.
Yeah.
And so, and depression. So I think it can be really useful. It's also really calming to us. Most people really grow to love walking, and it's
I get
so
some of my
simple.
best ideas when I'm walking too.
Yeah, good creative space. And if you're trying to lose weight, walking is one of my favorite things for weight loss, just because it's passive, it's not really taxing on the body.
Low intensity.
Yeah.
Great. I love it. All the gut health stuff is amazing. And I also know a big area of your personal interest and what I've seen you talk about is, shifting gears a little bit now, is incorporating functional mushrooms, adaptogenic items into the diet through nutrition, maybe even supplementation. How smooth can we make this transition? Are adaptogens and functional mushrooms aiding in our gut health? And I know a lot of them directly contribute to brain health, but where do they play a role in our longevity and our health and wellness and brain health, gut health, all the above?
Yeah, and I like to not put functional mushrooms in their own category because I think they're just a plant, right? So we talk about things in naturopathic medicine like holy basil, which helps, reduce anxiety, but also, our adaptogens, Panax, ginseng, rhodiola, ashwagandha.
That's my favorite.
Yeah, and then we have mushrooms too. They're another plant. They're another botanical that we can use to, change our physiology really gently. And so that's where I love natural medicine, is that you're not usually blocking an entire pathway like most pharmaceuticals do. Instead, you're kind of gently guiding the body one way or another. But I think mushrooms are really underutilized by the natural medicine community, and I think there's going to be a lot of cool stuff coming out about them. There already are a lot of great studies with them. Lion's mane is one of my favorites for cognitive
I use
function.
it every day.
Yeah, reducing the risk for dementia, reducing the risk for strokes in adults as well. And so there's such great research on all these mushrooms. And
especially turkey tail and reishi. They're just clinically studied out the wazoo.
Yeah, turkey tail has great research for, anti-neoplastic, anti-cancer properties as well. So, I'm really excited about where that's going to go in terms of how much more we can use them to help people.
Turkey tail and reishi in particular, I personally use them for and study them about their ability to influence the immune system. And to your point earlier, when we're looking at immune health, we're really talking gut health, right? So these items, these plants, these functional mushrooms, medicinal mushrooms, these plants are kind of doing their own thing, but again, go back to the gut health aspect, right?
Yeah, absolutely. Cordyceps, that's one that it's harder to get. Cordyceps sinensis it's a rarer mushroom, but it can increase the production of glutathione naturally in the body, and we need glutathione to reduce any oxidative species, like anything that can cause inflammation in the body. Anything that's bad for us can cause an inflammatory effect, and these antioxidants help to reverse that.
Yeah.
And so that's really important in gut health too, where you have maybe an inflammatory process going on. If you have inflammatory bowel disease like ulcerative colitis or Crohn's disease, or you have gastritis, which is an inflammatory condition and is super common. Like, how many people have reflux gastritis, heartburn, that kind of thing. And so, even though it doesn't seem directly related, reducing any sort of inflammation throughout the body is going to help your gut. It's also going to help your brain and everything else.
That's actually, it's funny you mentioned, that's been a little bit area of my personal health that has, I feel is very much improved. No, I'm late for my annual physical. I haven't got my labs and stuff, so I haven't actually gotten a panel on this yet. But for years and years and years, I had GERD, acid reflux problems, and really, even no matter how much I would try to focus on improving my gut health, or really, I should say, gut health wasn't really on the forefront of my mind. It was just, what am I eating? And it went from a very quantitative to amount of calories to macros. And over the years, it shifted into much more qualitative of just getting, a focus on quality foods while still trying to hit that caloric intake for the day. And the last couple months, as I've kind of taken on a lot of, I guess, I wouldn't say self-diagnosis, but just at-home protocols, trying to just, test a lot of things. How am I feeling in the morning? How am I feeling in the evening? How's my emotional health? How's my weight, my body composition, energy levels? And one thing I've noticed is that when I kind of focused on foods that I was studying that are pro-gut health, anti-inflammatory, and making those foods much more staples in my life, but also looking to some key supplementation, my need for relying on acid reflux medication prescription went from every day to, I honestly think the last time I took an antacid or something was maybe weeks ago.
Yeah.
Is that a good sign that I've been kind of taking over the reins again of my gut health?
Absolutely.
And that's probably a great telltale sign a lot of people can relate to.
Yeah. Reflux is one of the most common reasons people visit either primary care or a gastroenterologist. So it's really, really common GI condition. And it's a great sign when reflux is going away that you're really taking care of your body. It's also a sign that motility is improving, and likely you're moving out of more of a fight or flight place and into more of a parasympathetic rest and digest. Just because with reflux, things are going the opposite way, right? They're coming back up versus going down. And so whenever somebody comes in with reflux, I'm wondering, why aren't things moving in the right direction?
Yeah.
And is your body not in a place to actually digest food? Are you eating when you're rushing and going to work, or
Interesting, yeah.
Eating in the car between meetings, or
because you think it's one of those things that I put food in my mouth, it will digest, it'll do its thing. But am I hearing you correctly that there's maybe a better time to be eating, or maybe forcing the motility, forcing the metabolism, forcing digestion when our body's not quite ready for it?
Yeah. And this gets into the discussion of mindful eating, which I think is really important. But if you are not salivating, you're not ready to eat. And most of us will eat just
Well,
like
that only happens with like cookies and stuff, right?
no.
When we're like drooling over the cinnamon rolls or something.
Yeah, but
It's just me, I guess.
the reason that we're not salivating usually is because we're moving too quickly.
Interesting.
You know,
Okay.
we're grabbing something and we're going, or we're at a restaurant, it comes and we just eat it right away. Versus there's no preparation phase of the food anymore. You know, humans have been around for 200,000 years, and fast food industry started in the last 70, 100 years.
Oh yeah, we
And
skipped
so-
right to the end of the timeline on that one.
Yeah, we're used to like gathering our food, preparing our food, cutting it, cooking it, stirring it, all the aromas coming out. There's this whole phase of digestion called the cephalic phase, which means everything.
Cephalic phase.
Yeah, it's Latin for head. So
I haven't
everything
heard
in
that
the
one.
head. So it's the sight of food, it's the smell of food, it's even the sound of food, preparing it.
Oh yeah, I can think right now. I mean, as soon as you said that, a few like certain crisp vegetables, when you snap them or cut them or you're juicing something, it's got a lot going on.
Yeah, and a lot of that's starting in the brain. So your
Mm.
cephalic phase is what's happening in the brain to tell your body, okay, we're going to be eating soon. So let's increase salivation so that we have amylase in our saliva to break down carbohydrates.
Wow.
Let's start producing pancreatic enzymes from the pancreas so that we can break down proteins.
This is blowing my mind. I haven't thought about this approach to not only what we're eating, but why and when.
Yeah. No, and it's huge. It's really, really important. Our gallbladder releases bile when there's fat in the stomach too. Stomach acid, the majority of stomach acid is actually produced during that cephalic phase before the food ever comes into your mouth.
So the brain's got to like ready the troops. So am I hearing you correctly that sometimes maybe when we're hangry or we're reaching for that quick fix or we're just grabbing whatever's in front of us, that could directly, we could be the bottleneck basically. We are just forcing our bodies to do something that it has not evolved to do. It's meant to like see, to process, and then to send the signals for everything else to get into place.
Absolutely. Yeah.
Wow.
If there's one thing, like we have to slow down. Like if we did
so
that
true.
for everything, right? We just
Yeah.
need to slow down. We need to slow down with eating for sure. And so if you go through that cephalic phase, then you're practicing mindful eating. You're looking at things, you're touching your food, you're actually preparing it.
Incorporating all the senses.
Incorporating all the senses, sitting with
Yeah.
your food before you actually consume it, wait till you're salivating, and then start to eat the food. And this will make sure that stomach is prepared with enough stomach digestive enzymes and stomach acid to break down the food particles. And then chew your food. So this is a huge one, and I'm definitely I do this myself, but sometimes we eat and we're swallowing like huge pieces of food.
I will choke probably 2 to 3 times a week because I get so excited about food. I just love it, and I forget to chew sometimes, and it goes down the hatch. Yeah,
Yeah, and it's
that's bad for your health too. Don't choking. It's definitely bad for your health.
yeah, we don't want choking.
Yeah, you could cut it real short.
But you want your food to be almost baby food consistency. It should be
To that
pureed.
level.
Yeah. Like
Wow.
how many times should you chew? I don't know. However many times it takes to make a pureed, mushy baby food consistency. Because really it's the only place that we have more forceful mechanical digestion. So your teeth are actually ripping apart either meat or, vegetables, whatever it is. When people say I have undigested food in my stool, the only real answer is you didn't chew it. Because that's the only time where you can cut it up into pieces. What happens in your stomach is chemical digestion. So the surface of the food will get broken down by acid. Or the pH of the stomach is super low. It's 2. And then digestive enzymes. But you want to take advantage of the easiest way to break down food, which is your teeth.
Right. Yeah.
Yeah, and most of us are skipping that.
And to that point as well, another surprising thing that I guess the correlation between teeth chewing has for digestion and gut health. I am wrapping up Breath by James Nestor. Familiar with that book?
I haven't read it yet, but I've heard about it.
I never thought learning about breathing would be so interesting, but just all the things that the pulmonary system is responsible for, and really the thing here is, and to your point, we've been talking a lot about of going back to ancestral kind of processes. How do we live? What do we do? Community, natural foods, walking, all these things. They reference so many things of ancient civilizations and how important breathing particularly breathing through the nostrils, was in terms of like status in culture, status in society, status in tribes, the level to which someone could kind of rise to the ranks. They would even say a samurai warrior, like one of their final tests before they could become a samurai or they would get kicked out, was they would place a feather right beneath their nostrils. And if during breath the feather would move, well, then they hadn't mastered that kind of internal self and the breathing. And so many other things of like controlling blood sugar, controlling body temperature. I mean, all these monks that live basically in like a wrap out in the cold, and just through the power of breath, they can upregulate, downregulate temperature. But I digress. It's a great book. Check it out for sure. But just he talks about chewing and how in like the late 1800s, early 1900s, that was kind of a aha moment for orthodontists and dentists when they're really trying to understand why our palates and our mouths and our jaws were shrinking. It's because food at that time, the industries had become so much easier for us. We had so many more processed foods, canned foods. We didn't really need to chew. So chewing, by his work, is showing that it's also a direct correlation to changing human structure. We're not chewing foods enough to what you're saying, to actually break them down to let the rest of the system get to work. But it's also over many years changing our bone structure, shortening our bites, decreasing palate size, which then in turn gives people breathing problems, deviated septums,
sleep
so many
apnea.
sleep apnea.
Yeah, absolutely. And that process of chewing is going to, like, evolutionarily, it changes in terms of like having that jawline, like the wider jawline. And then also when you chew, you release serotonin too. So you're actually doing something for your mental health when you're
Really?
chewing. Yeah, it's part of that process, is actually making
Chewing
you
makes you
happy.
happy. Wow.
So, why do we love to eat? That's probably a piece of it. It's not the whole thing, but chewing is really important. So if you're on an all liquid diet, like, really consider not doing that. And then secondly, if you have to do that, then chew your liquids. If you have a smoothie for breakfast, I always tell my patients, chew your smoothie. You don't need to, but you want to get that serotonin. You want to tell your body that you're eating. You want to get those stomach acids. You want to start motility, and you can't really, fake out your body. Like, it kind of
really
wants to have the normal things that we're supposed to have as humans.
Or we think we can for the short term, but
Something
it
will
always
happen.
catches up.
Yeah.
Absolutely.
Yeah.
What are you most excited for right now? Where we are in the world, where we are as a species, given the last year, what the world has gone through as a species, and in your medical professional opinion, like, knowing like what we've gone through physiologically, biochemically, psychologically, where are you most hopeful for us moving forward in how we're digesting, how we're processing emotions and mental health? Like, where are you most excited for us right now in terms of holistic health and wellness?
Ooh, big question.
Dun, dun, dun.
Big question. I think the big thing that we need to talk about is how we're going to move forward after this pandemic. And so one of the things that I'm most excited about is the opportunity for us to really change things, like really shift how we're deciding to live in this world. And I think if there's going to be a time, it's right now, because we're all like shaken up and we're all like, this didn't work. A lot of people are having revelations over the last year, changing jobs, moving cities, reprioritizing their life, quitting jobs, and so
all the above.
all of them at the same time. And so I think it's a really good time for us to say, what are our priorities in life? And this is going to affect gut health. This is why I'm always asking people, how much joy do you have in your life? Because if things aren't matching up and you don't feel like there's a reason why you're waking up in the morning, you don't have a purpose, or you don't have strong relationships that you're excited about, people that you want to hang out with on the weekends, then your gut is not going to function, because you're going to be in a place of fight or flight. You're not going to be in that safe rest and digest place. And so I think as a nation, as a community, as globally, we can decide, how do we want to move forward, and how do we want to make changes on an individual basis, because of how we've reflected for the last year. Most of us can work remotely now, and so really putting our priorities in what makes us happy and what brings us joy, I think could be like a huge global change if we all decided to move that way. Yeah.
Truly. I have a follow-up question to that. I think it's so cool and unique to what I see you do, and maybe it's just, again, awareness theory, but a lot of doctors, a lot of care providers, PAs, NPs, DOs, MDs, a lot of people now in the medical space, health wellness space, they're doing what you're doing. They're starting off virtually, they're starting off on social media, and or it is now a very big part of their workflow. It's no longer just a hobby for a lot of people. It's no longer just growing a profile or following. It's actually what you do and how you do it and how you help people. How do you see social media? How do you see the internet being a tool for good for care providers, health wellness professionals like yourself, to speak to people in a way that they will hear and apply and be adherent to?
Yeah. This might not answer your question, but I think it's important.
Okay, go for
come back to
it.
that.
She's like, on a totally unrelated note, I have something else I want to
I'm
say.
going to take it here, Chase. No, what?
Doctor, you're not hearing me, all
Yeah,
right?
yeah. No, so I think the internet can be used as a tool, but it also has a shadow side to it, right? And so the tool piece is that, you know, I can put a post on Instagram and the entire world could see it, you know? And so I think really spreading education and getting a positive message out there is one of the biggest benefits we have of the internet and social media. And I can see people all across the world. You know, I can do health coaching in other countries. Like, there's all these things that we can do with the internet that we couldn't do if we didn't have it, which I think is really beneficial. But the shadow piece of the internet is that we're taking away human interaction. And so I started my company, you know, 3 or 4 years ago now, and I started it purely virtual. I was like, I only want to see people virtually through Zoom. I want to be totally able to get up and move or go to another, you know, go on vacation and be able to see patients from there. I want to be very mobile. And in the last year over the pandemic, you know, I've been one of the few practices that was fully virtual and said, no, I'm going to start seeing patients in person.
You went the other way.
I went the other way.
Wow.
Because I've realized the importance of being able to, you know, just have physical touch with a patient, do a physical exam, and really like be there with them. I think there's a huge therapeutic effect that you lose if you're not in person with somebody, for them to be able to actually like see your expression in person.
Which is funny because I think a lot of people will say, well, I get white coat syndrome. You know, I get more stressful, more anxious. My blood pressure goes up. I get more worried when I see the doctor. But now you, the doctor, is saying, no, actually, it's the other way.
Yeah. I don't wear a white coat anymore.
There we go.
Just throw your white
Well,
coat
there it
out.
goes. How do you get rid of white coat syndrome? Get rid of the white coat.
Yeah, really, yeah.
There you go.
It still
All
has
right.
an effect. But, and I mean, that's just a little piece of it. You can take your blood pressure at home afterwards if we really think there's an issue there. But you should have a positive effect with seeing your doctor in person. If you don't, then really evaluate the relationship you have with your doctor.
Good point.
But I think that you can have like a really beneficial effect of just being there in person. Sure, we can do most things over the internet really effectively, but you can't replace human interaction and social connection, especially after a pandemic.
Especially after a pandemic, which is why we're here. I kind of did the same thing. My show was an in-person experience before the pandemic, and then it stopped for a while. And then after a certain point, it's just like, no, actually, it's more of a detriment to be doing things the easy way, the virtual way, the remote way. There's no connection. There's no energy exchange. There's no building your tribe. There's no fulfillment in your relationships.
Yeah, and I think it's really nice to be able to cultivate that in person. You know, the fact that I can see your hands moving and, you know, when you're going to stop talking versus when you're going to start. These are all cues that we get, but it's also like a bonding experience as well. And when you're virtual, how many times do you get interrupted or you interrupt somebody else because we're not seeing that full human interaction? And if we think that it's just for us to not interrupt ourselves, then we're being silly. Like all of these things, like me seeing your smile and like even like the details of your face, like that creates a different experience biochemically for me to increase oxytocin, which is anti-inflammatory. Which
go there for us, please. Like why? Like I talk about this all the time. People will hear it all the time. In person, community, all these things. Like what is actually going on when we are around other people? Yeah.
And I don't know all of this because it's not my field, but, you know, oxytocin for sure is a big one. And you're going to get more of that in person than if you're virtual because your body knows that you're in person.
Yeah.
So there's more of a bonding experience. And, you know, there's been research now using oxytocin nasal sprays for things like fibromyalgia.
No way.
Because we know that it affects not only, you know, us feeling connected, but also, you know, our physical body and reduction
Amazing.
of pain and all these other things. You also get serotonin production, and serotonin helps regulate gut motility, which is essential.
It all links back to gut health for you. That's amazing. It's almost like you do this
Well,
professionally.
Yeah. And so you're going to get like a lot of your feel-good hormones, a lot of your endorphins, and endorphins reduce pain systemically. So, you have so many benefits, and you're going to see those exponentially rise when you're in person with somebody.
I couldn't agree more. And contrary to your rogue deviation, I think you actually did answer my question about internet. And I don't know, someone will correct me that I'm wrong, but no, she actually avoided the question, but I'm happy with it.
Pivot.
Yeah. What do you personally, if you'd be open to talk about something, what are you personally working on the most in, your health and wellness? Doctors are the ones always telling us how to get well, be well, but, I'm sure you're a human being too, right?
Oh,
you got
100%.
things going on. Like, what is maybe one key area of your wellness you're working on the most right now?
Yeah.
And how are you going about it?
For sure. This is, I've talked about this on one other podcast, but I haven't talked about it much. So if it's not fine-tuned in how I describe it.
A number 2 exclusive. All right.
But I've been really working on figuring out who I am as a person, mental health. And so for the last year, I dove in with a psychiatry practice, Hope Psychiatry, and wanted to see like what was there. So I had a trauma a few years ago. I had somebody pass away that really created more of like a PTSD experience for me, where I had real trauma, and I was ready to finally address it last year and see, what kind of healing can I undergo, because I needed it. Honestly, I didn't have much of a choice at that point. Like, I was getting triggers where I would have this reoccurrence of the trauma and things would come up. And so I didn't have another option, and I was really also wanting to go there at this point, and I think I needed to wait till I was ready to go there. But through the process, I thought I was just going to deal with PTSD and figure out that trauma and heal it and then move on. And I realized that there's so much more when you start digging in.
There's more to me. There's more to me than meets the eye.
Yeah, there's more to all of us.
We should all be thinking that,
And so a lot of the last year was just stripping away personas that I had acquired over the years, whether it was, control, like wanting to feel in control, which I ended up getting, having an eating disorder around, the idea of trying to be an idea of like perfectionism and trying to be, I'm type A, so like all the things that come around that. And so really stripping away these personas that I thought were me, and in reality, a lot of them weren't serving me. Some of them were serving me in certain ways. But digging into those and figuring out like, what do I want to keep and what is really not serving me anymore?
Yeah.
And what are the pieces of me, like my authentic self, that I didn't even know were there? And what do I want to start to cultivate and bring out? And so it's kind of been through this trauma work and getting in deeper with myself that I've been really seeing significant changes and just feeling more comfortable in my body and just like more at ease and more like secure in who I am as a person.
Thank you for sharing, first of all. Secondly, I'm so happy for you. I mean, that is no small feat. I was expecting maybe like, I'm really trying to ramp up my sleep health, but no, she's like, no, just who I am as a person. That's a huge undertaking, and I think ultimately we're all on that path as well. Whether the person listening right now is trying to fine-tune their gut health, improve their brain health, immune system, whatever kind of system or area of our wellness we're working on, it's a part of a bigger machine, a part of one system that is a part of the system. And so in some small way, we're all either on our way to working on ourselves as a whole, or like you, we're just deciding like, I want to start the whole system and kind of go down from there.
Yeah, and it's a long process, and I don't think it's not like 1 year and I'm done kind of thing. But I really dove in head first, and I'm excited to like kind of keep picking at things, and also just be happy with where I'm at. So at some point you can't too much self work can be detrimental as well, because we can go too far. But
Very true. Yeah, that's true. We can only have so many epiphanies or listen to so many podcasts or read too many self-help books, right? Well, kind of getting to the end here, I want to share something with you, if I could, just like, since you just shared something so personal. Everything you were just saying is exactly what I went through. Damn, I guess about 6 years ago now. And that 6 years ago was the culmination of about 10 years of not dealing with a lot of that traumatic event type stuff that happened. I too, I lost someone very close to me. My dad passed away at 19. And where I'm going with this is just how really related what happens to us as a human being, our emotional and mental health,
Yeah.
and then how it later will manifest physiologically.
Yeah.
Just not dealing with that trauma, not processing that grief properly, stuffing things down, and just trying to work on everything else exteriorly, if that's a word, exteriorly, in terms of training, nutrition. But then all of a sudden, X amount of time later, the body is like, no. We had some shit happen that, we're dealing with internally just because you choose to kind of turn a blind eye. It came up in just the worst ways. Anxiety and stress and identity crisis and relationships were crumbling. And it was the same PTSD associated to this traumatic loss and event. And so, I just want to share that with you because that was probably like when I'll say Chase 2.0 kind of finally came out, and it was through addressing, none of the easy stuff.
Yeah.
The deep internal stuff that took time, that ultimately led me to pretty much everything else that we're talking about here. Fulfillment in what I'm doing, really paying attention to my body and my diet and what I and it finally needs and wants. More importantly, fulfillment through relationships. And, I think that's really also what we're all kind of seeking is, like you said earlier, I think was, acceptance and just belonging.
Yeah.
And how can we know who is going to accept us for who we are if we don't really even fully know who we are at the time, which sounds kind of daunting maybe, but it's I think the most important work.
Yeah. No, thank you for sharing that. And to unpack something that you just said too, I don't know if you want to unpack it.
Let's do it.
You expressed like the bad things came up like anxiety. And I think it's so interesting to view that, a little bit differently in terms of that's your anxiety is your body saying something's not right and you're not listening to me.
Yeah,
and
hello.
It's such a paradigm shift where we say we have anxiety, we want to treat it. Do we want to treat it or do we want to listen to it? Like, do we want to actually sit there and say, why? Why is this happening? And so I'm not saying you don't want to move through it. Like, we don't want to sit with anxiety for the rest of our lives.
That was me then for sure.
Yeah. And so I think, depression, same thing. A lot of these things, same thing. Gut health, same thing. It's like, why are you not digesting your food, versus let's give you enzymes to digest it. And this is a big issue where I see in the functional medicine and naturopathic space is that we can become more of a green allopathic care system where we're saying, okay, you have anxiety. I'm going to give you lavender essential oil to decrease it. It's like, do we want to do that? Or are we going to be putting a Band-Aid, a natural Band-Aid over something and not listening to it? And so when we have these things, like you had a real trauma and your body responded perfectly, it caused anxiety.
Yeah, really. It's a really interesting way to say it. That just hit me hard. So often we make that link between these undesirable things that are happening to my body, illness, anxiety, it's negative. How do I get rid of it? How do I treat it? But no, how do we need to lead into it? Very well said. I like that.
Yeah. And do something about it.
Yeah.
We don't have to sit there for years with anxiety. I'm not saying just accept it and be happy with your new anxiety, but instead, like, really listen to where that's coming from. I'm so passionate about this now because of my own experience. Like, I'm not even accepting new patients that aren't willing to see the psychiatry team with me.
Wow, really?
Yeah. If you have chronic, a lot, and I would say 99% of chronic issues, they have some sort of mental emotional component to them.
Yeah.
Chronic issues I'm talking about. You didn't just get like sepsis and infection, but a chronic health issue that's been ongoing, whether it's hypertension, high cholesterol, whether it's chronic constipation, IBS, inflammatory bowel disease that's been going on. Like, all of these things, they have a component that's mental, emotional almost all the time. And so I think it's really, and the patient benefits more too. It's not me being
really
selfish, but I just really want people to be.
It's not a way just to up the copay.
No,
for sure.
not at all.
Yeah. That's very well said. And to your point, to kind of like to paint, the bookend picture here, that was me years ago. And this year, I think coming on the other end of a global pandemic, coming on the other end of a lot of major life events going on for me personally, professionally, and even just kind of, I mean, I've only been in LA now for about 2.5 years, and it's just kind of like a lot of things I feel of like a season has ended in a way. There's been a lot of change and transition, and I think anybody can relate to change and transition in your life, personally, professionally, has a tendency to kind of show up in these quote undesirable ways, right? Anxiety, stress, and I have been going through some intense burnout, like just stressed out, detached from work, unmotivated. And like, I'm the guy over here talking about like showing up every day, you know, you got to stay motivated, find your why. Like I do, like why I do what I do is still there, but the process for me has gotten a little stale, and it's just a lot of these little contributing factors that are very similar to what I went through years ago. But because I leaned into that, did a lot of personal work, got a lot of professional help, it's no longer scary. And this has been a good reminder. So I thank you for that. Of like, anxiety is a good thing, I will say. It's a cue. It's a whisper. It's a whisper for something our body needs attention to, and eventually it'll turn into a scream if we don't pay attention.
It absolutely will. And burnout, you know, it's the same thing. We can, like a lot of entrepreneurs, every entrepreneur is going to experience burnout if they haven't already. Yeah. And it's your body saying it needs rest.
It's fine. It's great. Everything's fine.
Yeah. Like we need to rest. Yeah. We need to pivot. We need more creativity. We need something. And so, yeah, if we listen to our body, the things that we will learn are incredible.
I love it. I think that's one of my biggest takeaways there. Just really listening to our body. I mean, it's already probably telling us things. Would you agree that, hey, here's A, B, and C to work on first?
Yeah. And I came from a very research background. You know, I was in research after college. It was like super black and white. Like if it's in the research, we have an answer for it. If it's not, we don't know yet. And I'm moving much more into like energetics and spirituality. And part of that is intuition. And you can listen to your intuition. Your body will tell you. And intuition is something that can be fostered and like grown, and like you can actually cultivate it, and you can get better at listening to your body.
And improve your gut health, improve your intuition. Where does intuition come from?
Comes from your
gut feeling, right?
Gut feeling.
Yeah, it all comes back. Yeah. Amazing. Well, it's been such a pleasure having you on the show. I've been wanting to pick your brain for a while now, ever since meeting you, about, I think like a year ago. Yeah. So thank you again for coming on. I love the work that you're doing. And no doubt this was super helpful for at least one person listening, watching. And a perfect way to wrap up the show, and I ask this question of everybody, ever forward. That trauma that I went through years ago, I told you, that was my father's phrase. That was like the mantra we grew up with in the household, and it was something that we just heard. It was like, cool, Dad, great saying, cool, all right. Yeah. But then when he was sick, he had Lou Gehrig's disease, ALS, and it was something that he embodied and completely manifested, you know, and we got to witness, like, this is what it means when things get hard, how you not only continue to take care of yourself, but continue to take care of those around you. So that's where that comes from.
Yeah, it's beautiful.
Thank you. So I was asking my guests, what does that mean to you? How do you interpret those two words? What does living a life ever forward mean to you?
Oh, I love that. It's a beautiful story.
Thank you. Can't take any credit. It's all Pops, but.
Yeah. Ever forward, what does it mean to me? I think it's kind of reminds me of the phrase like, this too shall pass, and we will move through. Yeah. And so I think sometimes when we're in the middle of the storm, things can feel like really daunting for us. In the middle of a pandemic, feels like it's never going to end. And just the idea, this inner knowing that this too shall pass, we will move forward. And so, yeah, just being secure in what you truly know.
This too shall pass. That's probably one of my other favorite phrases. Yeah, absolutely. Yeah. Amazing. Well, Dr. Mary, where can everybody find you? Of course, I'm going to have all the information down in the show notes, video notes for everybody. But where you hang out the most online, where they can connect with you as a patient or just, you know, learn from what you got putting out.
Yeah, and thank you for having me. This was fun.
Of course, you're welcome,
Instagram is at dr.marypardee. So I put out infographics about gut health and anti-aging in general. And then our website is www.modrnmed.com, and it's modrnmed.com.
Okay. And that's where you do telemedicine, put out educational.
Yep, and we do complimentary 15-minute phone consults. So Amazing. If you're looking to work with a doctor one-on-one in a functional medicine, category, then you can definitely hop on a quick phone call to see if it's a good fit for you. We also love referring to other practices. So if we're not a good fit for you and we know somebody that is, we'd be happy to do that. And then we also have a gut health course. So if you don't want to work with us one-on-one, or you can't work with us one-on-one for some reason, then we have a 10-day gut health course that's found on our website as well. But
Amazing.
We go through reflux. We go through, what natural, normal digestion should look like. We talk about inflammatory bowel disease. We talk about IBS. We talk about helminthic therapy, like worm therapy for gut health.
All right, that's maybe like year 3 LA stuff for me. I haven't gotten there yet.
Yeah, putting bugs inside of you. So we talk about a lot of cool stuff in that. So that's another way to interact with us.
Beautiful. Well, thank you so much.
Thank you.
All right.